we just feel like we need to, of course, decrease on the amount of sugar intake, but we also need to be aware that foods are digested essentially to become something else. So you cannot say that your child will not get a cavity because they do not take sugar, but they're still taking rice, they're taking ugali, they're taking bread. And right now there's a lot of processed, like highly processed starch, which is essentially just like sugar. Hello guys, welcome back for yet another episode of My Oral Health Diaries. I hope you have updated yourself on the previous episode. We are on the last week of Pediatric Oral Health Awareness Month. And today I'm just going to be doing something light and just following up on what we did last week. So last week we discussed about dental caries in children, and we discussed what dental caries is, or decay. And today we are just going to be discussing how to prevent decay in our children and to make sure that, they have healthy teeth. So since we discussed last time that, plaque is the major contributing factor to dental caries, of course, my number one is going to be proper hygiene. Proper hygiene we discussed with Dr. Munyao in, I think it was episode 10 or 9, you can refer, and we discussed how to make sure you're practicing proper oral hygiene for, children, depending on the age group. So we really need to be keen on that. Make sure you're instilling good habits and make sure that, the child adapts this when they're still very young. Another very important way that you can prevent decay in children is fluoride therapy. Now, we have talked a lot about fluoride, and it's actually been a big topic, especially in Kenya and basically in Africa. So in Kenya, it's been a huge concern because of the high level of fluorosis that is occurring currently. But fluoride is, I look at fluoride as a double-edged sword. So it's a good thing and it's still a bad thing. It's a good thing because fluoride can prevent decay. But when in excess, then it becomes really bad. So we want our children to be brushing with fluoridated toothpaste, but these toothpastes have to be like age specific. Why we insist that you choose a toothpaste that is specified for that age is because of the fluoride content in the toothpaste. So for children, you normally recommend that the toothpaste contains up to 500 parts per million of fluoride only. And I think the greatest benefit with being in Kenya is that we have a lot of fluoride still in our water. So if you're able to kind of regulate and make sure that the child is actually taking in enough fluoride as needed, then even the topical application is good because it prevents cavities, but also the one that they're taking in is important because of building their strength. So we will discuss fluoride, but basically this fluoride that we are saying in toothpaste is important because it helps to kind of deposit fluoride onto the teeth. Now, in addition to the fluoride toothpaste that children are using, there's something we would like to call topical fluoride therapy. This we mostly do for children, especially who have high risk of decay. So what is a high risk of decay? What do we mean when we say high risk of decay? This just means that this patient has probably experienced decay severally. They've had more than 3 cavities. They haven't even reached preschool. So this child has experienced a high level of decay. So we apply a higher concentration of fluoride during dental visits to just make sure that we are strengthening the enamel. Remember, we said once the tooth is in the mouth, the fluoride that helps to prevent cavity is the fluoride that we are applying onto the teeth. So topical fluoride therapy can be done for children at the dentist after every 6 months, and it would be really good that we as parents are keen to make sure that that is done to prevent cavities. Another thing that we can do to make sure that there is no caries or decay in our children is to establish proper feeding habits. This topic of breastfeeding is like a whole topic, but I feel like we should actually get a nutritionist to come and sit down with us and discuss. what these different foods contain and how we can make better decisions. But as dentists, we just feel like we need to, of course, decrease on the amount of sugar intake, but we also need to be aware that foods are digested essentially to become something else. So you cannot say that your child will not get a cavity because they do not take sugar, but they're still taking rice, they're taking ugali, they're taking bread. And right now there's a lot of processed, like highly processed starch, which is essentially just like sugar. So we need to be really keen to know how to plan our meals. Sometimes when you go to the dentist, they may ask you to do a diary for your child to just record what the child actually eats. And what it helps us do is to check how you are spacing the meals and the constitution of the diet for the child. As I've said, like for sure, I would also like to have a nutritionist on My Oral Health Diaries to just emphasize the point of why nutrition is an essential part of this thing. But with Decay, the biggest contributor, of course, here is sugar, especially toffees. Toffees, what is toffee? Toffee is like, an example is like, I think kuna hii mpya that came out and then we were told it used to be there kitambo and then it's not so nice now. So it's called goody goody. There's that goody goody. And then there's another toffee that people really like. Yes, eclairs. And like so many people like eclairs. And when you just chew that toffee, it kind of like sticks onto your teeth. And that for children is just, it's really bad. But as I encouraged you last time, if children have to eat sweets, you would rather give them sweets just before meals and then they can have their meal. So sio ati tunataka kuwakazia kabisa, but you need to have a plan. Have a plan, okay? Another thing that you can do to prevent decay in your child, when your child starts growing and they reach a point where now they're developing permanent teeth, the dentist may recommend that your child get something we call a fissure sealant. So a fissure sealant is basically just a filling that goes on the chewing surfaces of the teeth. So you remember last time we said for adult teeth, they have like fissures, grooves, ni kama milima na mabonde, and they are not so uniform because sometimes you'll find that the fissure has a very like thin V-shaped groove. So the toothbrush isn't able to go down there. So once the dentist identifies these areas, then the dentist is able to put something into these grooves so that they're kind of blocked. Because if there's nothing there, then what happens, the plaque kind of sticks there and it now causes decay. Then at this point, you can't really blame the child or, because they are brushing, but the brush cannot reach these fissures. So fissure sealants have actually been shown to prevent 80% of decay in children. So I think it's a good thing to consider if your dentist recommends a sealant, especially early when the permanent teeth are erupting, then it's, just take it up. We are not at these things really help, because then decay can destroy when a permanent tooth, that first permanent tooth comes in and the child still has other baby teeth. You may not even notice when it's coming in, but that's like at around 6 years. But if you're consistent with your checkup and actually go, then the dentist can recommend that you get sealants. Now, in Kenya, based on the research that we've been looking at, we found that only 9.9% of children are being taken for checkup. This is based on that research that was done, the survey that was done in 2015. But I strongly believe we can do better. 9.9% is really low. So at what point can the dentist pick up, such issues like making sure that we recommend sealants or like we recommend fluoride therapy? These are all preventive measures, and you remember prevention, it comes before. So you have to do checkups. Don't wait for when the child is complaining about pain. Don't wait for the child to have dental abscesses or, for the child to have a poor quality of life. Children with cavities can even get like malnourished because they are feeling so much pain when they are chewing. Sometimes they may not be able to articulate, but the child is uncomfortable. It also affects their self-esteem. So I really think that prevention is the key to, all this menace of dental caries. If we can just do that, make sure that we are going for checkup, make sure we're doing proper hygiene and follow the like what we've discussed, the recommendations with regards to prevention, then I think we can do better. And I believe we can do better. Thank you so much for joining us on this week's episode of My Oral Health Diaries. I promise this week I'm going to be short, precise, very jolly and happy because we are discussing about prevention. Aki prevention ni kila kitu ase. We can make a big difference. So let's spread the word, tell everybody. You know, kuna mtu aliniambia nina shoutingi kila time nikisema check up na nitaendelea kushout check up because that is the key. We really don't enjoy seeing you guys in pain. That's not the essence of dentistry. Okay, so guys, we can actually do better. As usual, please continue liking, subscribing, and sharing. I really appreciate your support, and I believe we can make a huge difference in oral health care in Kenya. Let's just continue learning and educating ourselves, and we'll see you again on the next episode of My Oral Health Diaries.